Welcome to Black Health Matters. I'm your host, Daryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
And they have a MRI that you can get that insurance won't pay for. It's a whole body MRI, and for at least $2,000, it can cover from head to knees anyway. And question is whether it's worth it because uh, since insurance doesn't pay for it, you have to
Hi, good morning. How
go
are
out
you?
of pocket. Uh, and the
I
price for it
am. I had
ranges from
sleepy eyes this morning,
a
so I
thousand dollars
got
to
up later than I had anticipated because I,
Joyce, you need to be on.
Joyce, can you mute Joyce?
Yeah.
And also Janice, can you mute?
Yeah. So question is it worth it? And so there's a long article that discusses the pros and cons and the fact that 1 in 20 of the tests that are done, I'm sorry, 1 in 20 of the people who get this full body scan is completely normal, whereas you have equivocal findings and findings that necessitate a biopsy or something like that. In the final analysis, he felt that it was something that if you got the cheapest one, which is $1,000, or you got the most expensive one, which is $4,000, that it might help you rest uh, without worrying about whether you're going to die tomorrow or not. On the other hand, you may have some findings that are equivocal and may necessitate the need for a biopsy. But it's something that since insurance isn't going to pay for it, it's something that you have to be willing to finance and also be willing to accept the vagaries of what they may find, because they may find things that are equivocal or find things that require follow-up but don't require anything special, and they may find nothing. So the question is, do you want to worry about what's going to kill you yesterday, today, or tomorrow, or do you want to just go on as we do now? Because we all are dying, but we just don't know when we're going to die. And so it's an open-ended issue, particularly because it's something that you have to pay out of pocket. So you have to make a decision as to whether it's worth it or not. The article was very equivocal in terms of saying it's there for you. So if you are worried about what's going to kill you and whether you need to do something, this particular person did find that they had a pancreatic cyst, which was benign, but needed to have follow-up, but no other real pathological findings. So he's reassured that he's not probably not going to die tomorrow from something that he's not aware of. So the question is, do you want to get a full body scan? Janice, you had your hand up.
Yes. Is that new that insurance doesn't pay for it? Is that the same as the PIC scan?
I don't know what the PIC scan is. This is a
Yeah.
full body MRI.
Okay. I had a few friends several years ago who decided to do that. Um, I don't think anything significant came out of it. And they said it was the full body scan, and they did have to pay for it then, but they thought it was beneficial to go ahead and have it done.
Right. Any other thoughts? Because this is
Yeah.
an individual decision.
Mhm.
Daryl?
Yeah, I just did a search on body scan near me, and there's a company advertising it for $24.99, and it
Mhm.
says it's SHHSA and FSA eligible, meaning you can get the health saving account. It's eligible to save for it, or you could use financing. There's a healthcare financing program called Care Credit, and so it's eligible for Care Credit, where you could finance it interest free for 12 months.
Any other thoughts or comments? So the only difference is that you have to come out of pocket for it. And the question is the information worth it to you? And that's the only
Good.
question. Betty?
Yes, good morning, everybody. I don't think I would spend that kind of money just to know what the problem is, because even if they found something or even if they didn't find something, I could go out the next day and get hit by a car and be dead. So I don't think I would spend that kind of money. I just wait until whatever happens, happens.
Any other thoughts on this very interesting, provocative topic?
Good
Yeah,
morning,
my
everybody. Excuse my voice. This is John Tatum. Um, my thoughts on it are that, we're always talking about uh, an ounce of prevention is a pound of cure, and we're always talking about early detention, early detection. And so this situation is in that realm. It's in the early detection realm, and it's also in the ounce of prevention realm too. So it's just quicker. I think that's the thing that will worry people. You want to find out things early about your body, sure. So early prevention, but how early do you find it? You want to go to a doctor, get an MRI, and find out today? Or do you want to wait a little bit? That's my thought.
Thanks for sharing. Any other thoughts?
Mhm.
Daryl?
Yeah, my comment is that the ones of us on this group session are probably not in the demographic where they're marketing this to, because if you got $2,000 is like pocket change to you, you say, why not? I'll have it done tomorrow. But 2,000 isn't pocket change to me, so you know
Mhm.
it's if I win the lottery, sure, I'll have it tomorrow.
Yeah. And that's how much my friends paid. But this was about 5, 6 years ago, and it was $2,000.
Yeah.
Yeah.
Okay. Any other comments or thoughts that you want to share
Yeah,
about this?
I had a question. Did you mention that if you get from the head to the knees, it's less?
No, I said that the cheapest one is $2,000, and that the most expensive one is $4,000.
Did you mention that you could get a partial?
Uh, when you say partial, you mean one that just
From the
goes to
head?
the head to the knees?
Yeah.
I think that's the cheapest one is $2,000.
Oh, okay. Okay. Thanks.
Any other thoughts about this interesting thing that's available now that only the kind of rich can afford, or those who feel that the investment is worth it? Because, as John says, the advantage is that you may find an early lesion that is treatable or curable rather than waiting for something to cause symptoms, which may mean that it's a late detection, which is harder to treat and harder to cure. So it's food for thought as you think about it. Uh, anyway, I thought I'd share it with you so you know it's available. And you can talk to your doctor about getting it done. And it's nice to know that they have a plan for those people who want to do it by installment plan, which divides the cost over months. Uh, so, okay. Any other comments? If not, we can start the articles. Oh, Dr. Perez?
One of the things good morning, everybody. Love you. One of the things that happens so often is that knowledge is generated or was generated with our tax dollars um, that we put into a lot of the research and study that comes up with these strategies and prevention efforts. Yet, we don't get an opportunity to benefit from them. And I think it's very, very important from a humanitarian standpoint that knowledge that we have be available to everyone. Dr. Oh gosh, uh, Dr. Callender, the surgeon from Harlem Hospital, who went into cancer research. You know who I'm talking about. He wrote the article about Black man. You know who I'm talking about?
You talking about Harold Freeman?
Yes, Harold Freeman. Harold Freeman said that if we just applied everything that we knew to everybody, what a significant improvement we would do for the health of not only this country, but the planet. So I think from a humanitarian standpoint, what is known and what is available to everybody, and especially in the United States, we should have that type of mentality. And we should seek that type of thought process from those that we elect into leadership.
The reason that it's not for everyone is that the data is not compelling to indicate that it is worth it. So it's just available for those who decide they want to use it until the data will, after analysis, demonstrates its merit and value to all. So right now, it's not enough data to say it's good for everyone. It's enough data to say it might be good. Uh, but your comment is very appropriate. Thank you for sharing. Okay. No other comment. We go to the first article then. Oh yeah, well, uh, RFK has done a lot of work over the last year, and he's now appointed very controversial chair of an advisory panel. And what this will result in will be interesting. This is somebody who's always opposed vaccines and all that, and so it's going to be interesting to see what consequence it will be. Uh, Most of Kennedy's replacements are like him, who have a lot of concerns about the importance of vaccines. And so this is another side of the coin. And so time will tell whether this is the right way to go or not. Most scientists don't agree, but time will tell. This fits right into what would be expected of RFK and Trump.
Callender, how is it ever been? I mean, I'm so baffled that somebody with absolutely no experience in medicine could, I mean, how does this happen? And why are we allowing it?
Well, you put Trump in the presidency, which gave him the
No,
power to put people
not
in
me.
these
Thank you.
positions. That's how it happened. You put a man in power who has the option of putting people in positions who don't have the so-called credentials that we say are important. He doesn't. Trump doesn't believe that those credentials are essential, and neither does RFK.
This is just such a travesty. I don't like to get too political, but this will kill people.
It is and will, yeah. But they mean well. Some say the road to hell is paved with good intentions, but they mean well. So did Hitler and other people like that. But
Sorry.
they mean well. So you're right. It's consequences. Uh, when we think of what the great things that have happened because of the vaccine, not having a vaccine is. You think what happened if we didn't have the Jonas Salk and the polio vaccine and all these other vaccines? Yeah, these vaccines save lives. So doing away with them does just the opposite as you are pointing out. So one of the things we're going to learn is the importance or unimportance of scientific methodology. And other comments as we read more and more about people in positions without scientific backgrounds who will be controlling the day for the next 4 years. Okay, if there's and this same thing about this delaying hepatitis B vaccine, which was given to all newborns. And so whether this will result in change in death rates, we will see. So,
But don't we have the data to show? I mean, I'm sure there's public health data or some kind of data that we could that could be used as a defense against stopping these things that are already working.
well, it can't
Or
be
do
because the people who are making the decisions are not scientists. And so they are looking for data to
to stop it.
yeah, to stop it. And where they don't have data, they just do what they think is okay. It's a tough time for people who believe in the scientific method and the methodology that so when you put people who are not credentialed and are not scientists, then you have to deal with the consequences. So what will need to happen, we'll have to accumulate data to identify reasons why we should go back to the scientific method or why we should continue this new methodology with people who have no scientific background running things. Dr. Perez?
I think one of the worst things that is occurring is the lack of trust. And so people whose lives are so busy and don't have access to good public health information see this confusion. And even when we remove the present administration, confusion will remain. So all of the work that has been done to get parents, to get families, to get communities to believe and trust in the CDC and immunizations and all of that will go to naught because of the confusion that Kennedy has started.
Well, I can't say he started it. Trump started it before Kennedy got there, and
Absolutely.
and uh, Kennedy just plays right into what Trump wanted in the first place. So, uh, and Trump has no expertise, and neither does Kennedy. Okay, let's go to the next article, unless there are additional comments or questions. This is another article. It's similar to the one we discussed last week, in which we uh, are concerned about a new flu vaccine, a flu strain, and are concerned about whether the flu vaccine, is going to be effective at preventing hospitalizations and deaths from the flu. And we don't really know the impact of the vaccine on the flu. But based upon what's happened in Australia and other places, we are fearful that it's going to be a very active season with hospitalizations and deaths, and all, particularly in older people. So it's even more important than ever to have be vaccinated, and also if you're over 65 to get the more potent vaccine. So far, it's kind of early to tell, but based upon past experiences, what happens in Australia and other countries is likely what will happen here. But we will wait and see. And the comment that Dr. Perez made means that people who were not trusting the CDC before going to trust it less, and so the vaccination rates are likely to go even lower. So it's going to be an interesting flu season. The advice, though, is to take advantage of the vaccines that we have and get them. Now is the time to get them. Mr. Buchanan?
Yeah, thank you, Dr. Callender. I was wondering, it's shocking to me to see these numbers of deaths from the flu. Um, is there, uh, you know, people are not really worried about the flu, compared to COVID, you know, and I get a flu shot every year. I mean, when I was teaching, I remember before I got vaccinated, once I caught the flu, and it was pretty bad. It was pretty bad. I stayed home because it was so bad, and I never stayed home. I had perfect attendance, but yeah, it was rough. So I committed to getting a vaccine every year after that, and I never had the flu after that. So, but to me, it's still surprising so many deaths from the flu. Thanks.
Okay, it's not, yeah, it is lamentable that the flu is so deadly. It's particularly people over 65. Uh, but it's going to be interesting to see if that's how this holds up. But what we can do is get vaccinated, and that's where we can play our part and get vaccinated. Any other comments? Okay, all right. Let's go to the next article. Well, this is nice to see that sometimes we see so much negativity from the Trump administration that we have some positive things we don't recognize them. So To see that Trump signed a measure authorizing billions of dollars in federal funding to help prevent drug overdoses is welcome news. And based upon the fact that deaths from overdoses have decreased because of the use of the availability of drugs is a wonderful thing. And so this is something that is very positive. Buchanan?
Yes, I heard, I don't know, maybe Daryl can verify this, that Trump had a family member who died from addiction. So, it's like a personal thing for him. So maybe you could check that out. A brother, something like that.
Well, it's good news. Any other comments? Okay, well, let's go to the next article. This is a surprising article that says that colorectal screening by colonoscopy is the state of the art, but that CT colonography, uh, after it's being studied, is cost effective for Black adults, which is an interesting study because not too many people really knew about CT colonography, where you take a dye by mouth and they can just follow the dye and screen the colon. And so they're saying that this is uh, a study that could be done to eliminate the colonoscopy, which of course is state of the art. The problem with the CT colonography is that you can't biopsy it, whereas with the colonoscopy, you can remove the polyps, which are the potential sources of cancer. And with the colonography, it just gives you an opportunity to identify the polyps, and also you'd still have to go in and take them out. Daryl?
Yeah, back to John's question, John Buchanan. Donald Trump's older brother, Fred Trump, struggled with alcoholism and died from a heart attack at age 42, a loss that Donald Trump often cites as a reason for his own lifelong abstinence from alcohol, noting his brother's death was a stark example of addiction's effects.
Any other comments about this article, which is interesting in that it's effective for white adults, but also particularly for Black adults who may not even get the colonoscopy. I don't know if people were aware of CT colonography as an option, but it is something that for people who are wary of colonoscopy, this is something that is available. Any comments or questions about this?
What did they mean with this highlighted situation here? The status was cost effectiveness ratios. Can you explain that?
Well, they just looked at how much it cost to get a colonoscopy and how much it costs to get a colonography, and that ratio was what they are talking about in terms of what was cost effective for white adults and cost effective for Black adults. I'm not sure if that answers your question, but the data based upon their studies identified that more people who actually got the colonography then got the colorectal screening, which is colonoscopy. And so they are now saying that the most cost-effective screening strategy for blacks is CT colonography. I'm not sure that I would, even though it may be cost-effective, it still is just one step. But I think in the long run, if more people are willing to get the CT colonography, then it may be in the long run more beneficial, which is what this study is showing. It was the first study that is showing that while colonoscopy has a great advantage, still, if more people are willing to get the CT colonography rather than the colonoscopy, then it's something that's worth doing further studies on.
Dr. Callender, my question is there a biological difference between blacks and whites in terms of colonoscopy versus the CT scan?
Well, I think it's just it may well be that it seems that it's cost effective for both, but uh, both blacks and whites have uh, polyps, and both blacks and whites have polyps that turn into cancer. So I don't think there's a notable difference
Okay.
between blacks and whites in colon cancer.
I would sure rather have a CTC rather than a colonoscopy.
But the difference is if you have a polyp, you're still going to have
True.
the polyp removed because polyps are precancerous.
Good point. Then you get both. Then you're stuck with both.
Unless your colonoscopy is negative, in which case
Yeah.
that's the end.
Seems I always have a polyp that needs to come out, so I'll just continue doing what I'm doing. Every 5 years isn't so bad.
Yeah. And the biggest thing is the prep.
Yeah. Although that's getting better.
Yeah, that's what they say. Betty Bella,
Yes. What exactly is the difference between the two?
colonography means that you take a dye by
Oh,
mouth, swallow it, and they do x-rays,
oh,
CT scans
yeah.
to follow the dye from the time it goes into your mouth to the time it comes out of your anal rectal area.
Okay.
And they study the large intestine to see if there's any evidence of polyps or diverticulum. And so if you have no polyps, then that's the end of it for you. But if you've got polyps, then you still
You
have
have
to
to
have
have
the polyps removed.
Mhm. Okay. Thank
But
you.
it seems like more people are willing to get the colonography than are willing to have the colonoscopy. And that's why it turns out that it's more cost effective. But
I I really think a lot of people probably prefer the other because a lot of people don't like to be put to sleep.
oh, well,
That's
well,
my opinion.
while that's the case, if the colonography is positive, you will still need to
Still
be
have to go to sleep.
right.
Yeah.
But if it's negative, that's the end of it for you.
Mhm.
And that's the advantage. So, Sylvia,
Yes, good morning, everybody. The question I had regarding polyps, they say once you have polyps that you come back at a colonoscopy every 5 years. I was just thinking about it's a slow growth of polyps. I mean, it takes, once they're removed, um, is it I want to like 5 years before it comes back, or how do you know it doesn't come back like before the 5 years come into play?
we don't know. We just know that usually if you have no polyps, that it's going to take at least 5 years for it to grow back. Whereas if you have, some people are polyp formers. So within 3 to 5 years, they form new polyps. And those people who have no polyps are not polyp formers, so they think they can wait for 10 years for them. And there are families who are polyp formers, and so they they're more likely to have colon cancers.
Mm.
Janice?
Yes, years ago, I was told I had polyps, and I get my colonoscopy every 5 years. And I've been doing it almost 20 years, I think. But do the polyps ever go away? I've never had surgery or any type of removal that I'm aware of.
Well, that means you don't have any polyps. The polyps do not go away.
They don't go away.
No.
Okay,
So if you have them, they need to be removed.
okay. And I do get the colonoscopies every 5 years, but I guess I have to look into it. I
Right,
mean,
because if you're not a polyp former, then the colonography may be all you need.
okay.
Okay, any other comments or questions about this important observation that needs to be shared among the white and black communities? Because a lot of people
Uh,
are aware that you can do it just by CT scan.
I have a question, Dr. Callender. If you go back every 5 years and you have polyps that have to be removed, um, it seems to me that something needs to change as far as um, maybe your diet. Maybe the doctor should change your diet. What do you think about people who have polyps every time they go back every 5 years? They go back and have polyps. Do you think they need to do something like diet change or something?
Well, I don't know the answer to that question. Nor do I think that anybody does, but it's food for thought. I don't know anybody who's really studied it to see if a diet change would eliminate the way in which you form polyps or don't form polyps. I don't know a study that has been done yet to analyze it. But your question is an excellent one, and but I just don't know the answer to that. Anybody out there who does, please share it with us. Betty?
Yes. Am I correct in thinking or remembering that somewhere it was said that after 80, you don't really need to have a colonoscopy anymore?
Well, there are studies that one of the reasons that people say after 80, the likelihood of if you're not a polyp former, so that's the key. If you're not a polyp former and you're healthy enough to have a survival of 5 years or longer, it is the thought that if you if you have no illness, then you can have a colonoscopy. On the other hand, if you're frail or you have any complications, uh, then it may be risky to have a colonoscopy. And in that kind of situation, if you're not a polyp former, a colonography might be a better choice.
Mm. Okay, there are times that I have had polyps, and then there were times that I did not have polyps. So I don't know whether that would make me a performer or not.
Well, I think colonography, CT colonography, uh, is something that is valuable for those people who are not polyp formers. For polyp formers, the colonoscopy has an advantage. Uh, we we don't really have an answer for why some people are born who are polyp formers, and some are not polyp formers. I don't know whether the diet can be the major reason for it or not. Dow, you had a comment.
Yeah, my comment is that a lot of people have reservations about the general anesthetic for a colonoscopy, and you have a choice. You could ask for a colonoscopy without sedation. and it's generally safe. It's common in many countries. It offers benefits like no recovery time. You don't need an escort needed after it's over. It takes a few minutes longer, uh, but there's no problem in getting a colonoscopy without sedation.
Thank you for sharing. Any other comments? Very important topic, and for those of us who are over 80, this is an important question because there have been articles that looked at that topic, and they are suggested that if you're healthy and over 80, uh, and you are likely to live 5 years, that a colonoscopy uh, is of some merit. And of course, of the two, the CT colonography may be the safer choice. Any other comments about this very important article? Sylvia.
Yeah, I was going to follow up with what Daryl said. Now, if you don't need the anesthesia, how painful are colonoscopy? And if they're not that painful, then why get an anesthesia? I mean,
It's up to you.
uh,
It's a personal choice.
oh,
Yeah, it's personal choice. It may or may not be uncomfortable. It depends upon your anatomy and how much air they have to put in to negotiate the colon nos the colonoscope moving through the large intestine.
mhm.
Because the colonoscope goes and throughout the entire colon from the cecum, which is the beginning of the large intestine, to the anus, and so that's a lot of territory, and it requires a lot of pushing of air, and sometimes that can be uncomfortable, and that's why people get fentanyl, which puts you to sleep for a very short period of time.
So polyps are isolated in a certain area of the colon?
You have the right colon, the transverse colon, the left colon, and you have the sigmoid colon, and polyps can form anywhere along those lines. And wherever they form, they have malignant potential and can be transformed to cancers. So whenever they form, they should be removed.
Okay, thank you.
Uh, Janice?
Colonoscopy and flexoscope. I know a flexoscope doesn't go quite as far, but can it be used instead of, or how far does the flexoscope go?
As far as I'm concerned, anything that doesn't go to the cecum is not worthy. The sigmoidoscope, that means that they only go up to the sigmoid colon if they only go to the left side of the colon. But the colon exists from the cecum, which is the right side of the colon, to the transverse colon, to the left side of the colon, to the sigmoid colon. So you've got a lot of space for polyps to form. And if you have a polyp in any area of those, that can undergo malignant transformation. And so it is felt that the entire colon should be inspected.
Yes, I know the flexoscope is one where you really don't need to be sedated, but I know it doesn't go quite as far.
There's no comparison.
Okay.
Yeah. Let's see, Daryl.
Yeah, I've had the colonoscopy without sedation. You're awake. You can talk to the doctor. You can watch on the monitor as they do the procedure. There's a it's I wouldn't say it was painful. There's a little bit of discomfort. You can feel the pressure as the scope moves. Um, they use carbon dioxide instead of air. That can reduce the bloating. Um, but on a pain or discomfort scale, I'd rate it about a 2, so it wasn't bad.
Okay, thank you for sharing, Betty.
Yes, Daryl beat me to it, but I was just going to say that I'd had one too without being sedated in the beginning when I first started having colonoscopy. Um, I wasn't sedated. But lately, last 2 or 3, I've had, the doctor didn't give you a choice. He just, just went on into and the one without being sedated, like Daryl said, is not that uncomfortable. I didn't have a problem with it.
Any other comments? If not, thank you for discussing this very important article. Okay. Let's go to the next one. Interesting article that talks about the human condition and how important it is for us to talk and to communicate. And that there's no pill that beats that. When John Robinson was with us, he talked to us about the importance of having communication with the patient and psychotherapy, and how that was an important part of treatment, and that no pill could replace that. And that's kind of what this article is talking about, that actually communicating with the patient and finding out what's really going on, and actually spending some time with psychotherapy is something that no pill can compete with. And so, with all you're getting, it's important that that be part of the process, because uh, the healing process is hastened by the communication that goes along with the psychotherapy that is used by the mental health professional. Any comment or any? Those of you who had psychotherapy, and those of you who have had only the pills, and those of you who've had both, can make a comment about it. But I think this is an important part of the art and science of the practice of medicine, and something that the pill does not exactly duplicate. Dr. Perez.
It's critical. It is so critical. And it's so important for men. Oh my gosh, we have got to be disciples out there, making sure that it's not just the pill, and making sure that we maintain the importance of this communication.
Yeah, so, in this day and age with CAT scans and MRIs and all that stuff, and all these lab tests, there's the temptation to do away with the human connection, but nothing replaces that, not AI or anything else. So your point is well taken. John Buchanan.
Yeah, I've had the pleasure, I'd say, of having uh, all of those benefits, the medication for depression, uh, psychiatric uh, help, and psychological help and therapy, and they're all good. The one I lacked, that I liked the least, though, was the medication. So yeah, I think it's a good thing. It shouldn't be a shameful sort of situation if if I realized that I was having ideation, you know, it much more I don't know, satisfying, much more comfortable to get help, and to talk it out, and share it with someone else. Thanks.
Any other comments? Thank you for sharing. That's one of the things that John Robinson would emphasize time after time.
I know one thing that was very helpful for my adolescents, and I think of adolescent males in particular, was letting them know that just like if we left a diabetic without access to insulin, leaving somebody who's depressed. If you're depressed, that means you're not thinking right. That means you're not thinking as fast as you can. You're not making the decisions that you should be making. It's not just the blues. It's important. It's you wouldn't you we talk so much about hypertension and our kidneys and following that. It's that important, if not more.
Thank you for sharing. Any other comments? If not, we'll move on to the next article. This is one of critical articles that talks about the brain and keeping things creatively and how important it is that creative hobbies, as you age, allows the brain to stay young. And all of the studies point out that as you do music, dance, painting, and play video games and chess and those other things, that this is good for your brain and that it helps the brain stay young. The more creative and the more things you do that allow your brain to stretch, so to speak, uh, they keep your brain young. And so, of all things you need to do, being creative is one of them, whether it's by music or dance or art or whatever. Any comment by any of you? Because
Dr. Callender, what is the EEG and the EMG? What is it?
EEG is an electroencephalogram, which measures your brain waves. EMG measures your muscles, but the EEG measures your brain waves. And when they do that, they're able to identify how active your brain is and whether it's staying young or whether it's aging. And all of the studies have suggested that the more you use your brain for games and other things like that, and you stretch your brain for music or whatever creative hobby you want to do, uh, the more your brain stays young. And music and arts are as well as video games are the way to do it. Any other comments or questions about this? Because we're in that age group where the more active your brain is, the better.
Yes,
I was Go ahead.
Dr. Callender, I just looked at my husband and I told him that yeah, um he messes with me all the time because I'm playing solitaire or going to play for Keno or something about, and he seemingly is doing nothing. But when I just mentioned to him, he pointed to his phone. He said, "That's my exercise. I by the time I study my phone and learn how the cell phone, so
There's an article on that as
I think
well,
he thinks that's
which
his exercise."
which suggests that that's not the same.
No, it's not. I agree with you.
Yeah.
I like Sudoku.
Okay.
You like what?
Sudoku. It's a
Yeah.
numbers game,
Oh,
Yeah.
okay.
and
Yeah.
it's pretty challenging, especially when you get up to the
Yeah.
expert level.
Yeah,
Mm.
challenging.
Okay. Sylvia?
Yeah, I was just thinking about, you said this, they measure the brain waves, and I was thinking about President, where they were saying he was having an MRI and trying to see where he was in terms of dementia. Um, the MRI versus this other exam to measure the brain waves. Was that considered or any discussion regarding the president's
Well, MRI only looks at the anatomy of the brain, whereas EEG looks at the functioning of the brain. And the MRI of the president was allegedly normal, uh, but I didn't see any tests of the electroencephalogram that looked at his brainwave activity. But the anatomy, the MRI would show the anatomy of the brain, and that was determined by some reports to be normal of the president.
yes, so him being the president, why would they not have gone the higher level to see the brain waves?
It depends whether you're interested in finding out whether you have a brain tumor or something, or whether
Mm-hmm.
your brain is functioning. So it
Mm-hmm.
all depends. If you were looking for a brain tumor, MRI would be what you'd look for. If you just wanted to test the ability of somebody, you would do other ways, other tests.
So one last question regarding dementia. What do they do MRI for dementia, or do they do this other test to
Well, they do
determine?
both. They do both because the MRI can also identify amyloid deposits, which are a signal of dementia. So that, but they do functional tests as well as an MRI. So it's a combination of tests. Daryl?
There's no public information or official medical report indicating that Donald Trump has ever had an electroencephalogram as part of his presidential physicals or medical evaluations. He has released information about his Montreal cognitive assessment and his recent MRI.
Joyce? Joyce?
When I was going through my episode of having the couple of falls, my doctors were taking me through a series of different tests. And one of the tests had to do with my brain functioning and how it's interacting with my body, really, I guess. But what they did find out is that I have beginning to show signs of aging. So my question to them was how did Alzheimer's fit into that equation? And they were saying that they didn't see any signs of Alzheimer's, but it was just interesting to find out all of the things that they tested when they ran these EKGs and MRIs and the results that they came out with. It was very, very amazing.
Thank you for sharing. Okay. Okay, let's go to the next article unless there's more comment. This is an article that talks about mental illness and substance abuse among physicians. Uh, Physicians are humans and they have the same problems everybody else has. And mental illness and substance abuse is not uncommon among all levels of physicians, whether they're in training or whether they've completed their training. And the Association of Depression, Suicide, as well as mental illness, is something that plagues physicians as well. Uh, this is something that I think all healthcare providers recognize that the mental health needs are great And when you're dealing with patients' lives, whether they live or die, becomes very crucial. And uh, your ability uh, to recognize where the healing begins and where the lack of healing uh, begins. That what is your role that you play in the healing process, and that becomes the key to understanding whether or not you can be able to cope with life and death uh, as a healer. Uh, and it takes time to recognize that life and death is really in the hands of the healthcare provider, and that what is in the hands of the provider is to do the very best that you can every single time, and to understand that the role that you play as a physician is not the ultimate role of life and death, but doing those things that put things in the situation so that the patient can heal or be healed, and recognize the role that you play in this process. And this then becomes what allows some doctors to be able to uh, survive without mental health issues and others not survive. Daryl?
Okay, I was just reading where self prescribing is banned in most states for physicians. So if they can't write a prescription for a controlled substance, they have to go to a dealer like everybody else.
They have to go to a what?
A dealer, the pusher man. They got to go
No,
to
no,
the
you
street
get
corner like
another
everybody
doctor to
else.
write a prescription for you. You get a mental health professional to write a prescription for you. You just can't write a prescription for yourself, but you have mental health psychologists and psychiatrists who can write prescriptions for you.
So is that you get your you get a mental health professional to write a script?
Yes.
Are they more likely to be more lenient to writing it for another physician?
Well, it is expected that if you have a mental health issue, that you go to a mental health professional, and this mental health professional would write your prescription,
Okay.
whether it's for medication or for counseling or whatever. And so that's the state of the art, that the physician doesn't heal himself, but does go to the mental health professional who could be a psychologist or could be a psychiatrist, who would then, and either psychologist or psychiatrist have the capacity to write prescriptions for physicians or non-physicians.
So where it turns into abuse is where the mental health professional isn't controlling the prescriptions properly.
That's correct. That yeah, yeah, they because uh, if they are not under the supervision of a healthcare professional, that's when the problems occur. And uh, although the physician is not supposed to write for themselves, there are circumstances when they write prescriptions and it's not controlled appropriately.
Dr. Callender, all physicians are under review and they could get in trouble and lose their licenses if they do not use the protocols that have been set up. Because I know some doctors, I have a pain doctor, and she has some kind of license where she can give out controlled substances more so than my primary care doctor. So everybody's back is being watched because, you know, you can lose your license.
Right. And every doctor has to be relicensed every 2 or 3 years, and also has to have a narcotic license or the ability to administer or not administer controlled substances. But the potential for abuse in the medical health profession is great, and the suicide rate as well as depression rate again depends upon your ability to understand the role you play in the healing process, and that's a critical piece to recognize how you help patients heal and what role do you actually play. And that requires time and maturity and an understanding of how you fit into the whole scheme of things. You talk about some physicians who feel that they are godlike and can control life and death, and those are the physicians who have the greatest difficulties. Any other comment about this critical aspect of healthcare, and that physicians need treatment as well as patients? Okay, let's go to the next article. Sleep is such an important aspect of our health. Um, Whether you take caffeine before you go to sleep, or whether you drink a lot of water before you go to sleep, or whether you sleep on your side, your back, all of those things play an important role. And it is recommended that you get between 6 to 8 hours of sleep every night. And when you get less than that, that compromises your brain's ability to recover and to clean itself out. And many of these behavioral aspects in terms of what time do you go to bed? What time do you wake up? Uh, how do you go to sleep? Do you put something over your eyes? Do you turn off the radio, turn off the television? Uh, there's so many aspects of the sleeping process that are important. Do you need to go to a sleep specialist to find out why you can't sleep? And what's the price you pay for not getting enough sleep? How does insomnia interact with your brain's ability to recover from day-to-day activity? These are parts and parcels of what are important because sleep is an important part of your health. Talk about health and lifestyle. Getting the proper amount of sleep is an important uh, lifestyle phenomenon. Any other comments about sleep, which
Dr. Callender, what is your thought about like the melatonin? Is
mel
that pretty safe?
melatonin is pretty safe. Whether it works or not is depends on a lot of things, but it's a relatively safe drug to take for sleep. It's more physiological than anything else that I know of. Daryl?
Yeah, I take 5 milligrams of melatonin before bedtime, and I see. I've read where you take any more than that, you could have a sluggish feeling during the rest of the day. So I don't feel sluggish, but I try that combined with other things that I picked up from the group session. And I'd say that maybe even 6 months ago, my average sleep was about 7 hours. Now I'm doing 8 to 9, feeling much better. It's had a positive impact on my blood pressure. Um, I've got better quality sleep because I'm not experiencing nocturia. So I do some of the tips that we've had in group session, like not drinking liquids after 6 p.m. or the last drink that you have with dinner, um, maybe being about 5 ounces instead of 12, 14 ounces. That helps with not having the nocturia. I hydrate during the day, and so that you could wake up at night because you're thirsty. So I'm not thirsty because I'm getting enough water during the day. But exercise that'll help for sound sleep, um, especially when we talk about the 150 minutes of exercise a week. So just getting a great night's sleep, 8 to 9 hours, for me anyway, it's really improving my quality of life.
Thank you for sharing, John Buchanan.
Yeah, I don't know. I must be a weirdo. I drink coffee um even at night, and I don't seem to have any problem going to sleep. I don't know. Maybe I'm immune to the caffeine, but I end up getting 7.5, 8 hours regularly. I use a sleep mask. I do have mild uh, apnea, uh, and I use a CPAP. And I have a complaint about the CPAP. Uh, I end up having like shallow breathing. I'd rather, take like deep breaths when I'm sleeping, but it seems to work. I don't snore anymore as long as I use the CPAP. Thanks.
Thank you for sharing. Any other comments about sleep?
I also do take the 5 milligrams of melatonin, and it's perfect. It just helps me fall asleep and stay asleep a little longer than if I didn't.
Thank you for sharing. Any other comments? Okay. Next article. This talks about the kind of sleep positions, whether you sleep on your side, your back, you put pillows under your knees, and uh, most people find sleep positions that are on the side are the most likely to be uh, free of tension and stress. But it varies from person to person, and I don't know if there's any sleep position other than bending knees, arms, etc., that contributes to carpal tunnel syndrome and some other issues. Any comments about the sleeping process and the position you sleep in? It's interesting that most people sleep on the side. Uh, as a matter of fact, most of the pictures you see on TV, people sleeping, they're sleeping on their sides. Rarely do you see people sleeping on their backs.
I think from experience, I found that the right pillow makes a huge difference. And if you haven't experimented with different types of pillows, especially if you're having trouble sleeping, it can make a big difference. And I have a lot of neck arthritis, and so I've tried several different pillows, and I finally found two that seem to work pretty good for me. So I would suggest that if you're having trouble sleeping, try changing your pillow.
Thank you for sharing. Okay, we'll go to the next article.
Oh, one more comment about sleeping. Sleeping on left side generally significantly helps digestion by keeping stomach acid down and easing heartburn and indigestion and aiding lymph drainage. Particularly if you eat right before you go to sleep, uh, you're going to be experience more indigestion by sleeping on your right side. So if you're a side sleeper and you've just eaten or you have indigestion problems, try sleeping on your left side.
And of course, it's not a good idea to eat and go to sleep.
No, I was just going to say that the earlier you eat before you go to sleep, the better off you're going to be. And I think the older we get, we tend to eat earlier in the evening.
Yeah. Well, I'm really speaking to musicians because you get back late from a gig and you got to eat and you got to sleep. So, yeah, you know what I'm talking about, John.
Absolutely.
Yeah. Thanks for sharing. That's important. Um, diabetic eye screening adherence is something that they talk about here. And they say that the biggest issue is getting a proper referral. And one of the biggest problems is that the eye screening process is often missed. And with diabetics, that becomes particularly important because glaucoma and the other diabetic retinopathies that occur need to be managed in appropriately and frequent visits. And deviation from this results in progression of retinopathy that needs to be addressed. And then, of course, we people of color have more glaucoma than other groups, and so uh, being sure that you keep your appointment at least once a year becomes important. And if you're diabetic, then the more frequent visits are critical in terms of ensuring that there's no progression of the diabetic retinopathy. Getting referrals are important, of course, seeing ophthalmologists and it's probably one of the commonest physician visits is to see the doctor, particularly after you reach 60. And since cataracts are ever present, along with glaucoma, these visits become imperative. The older you get, the more important it is. And the emphasis with diabetics is critical because the monitoring of the diabetic process and the diabetic retina becomes very important. Daryl?
Yeah, my question is about why do blacks more have glaucoma more often than other groups, and is there any connection between blood pressure and optic pressure?
There doesn't seem to be a connection between blood pressure and optic pressure, and I don't know the reason why we have more trouble with why blacks have more glaucoma than whites. Uh, what was the other question?
Why we have glaucoma more often in relation between blood pressure and optic pressure?
But I don't know if there's a association between the optic pressure, which is the pressure in the eye, which is what glaucoma is, where you have an increase in intraocular pressure, and the association between hypertension. I don't think it's known, uh, but it's food for thought. John Buchanan, you had a question or comment?
Yes, what is diabetic retinopathy?
Oh, that's where the impact of the hyperglycemia actually affects the retina and causes uh, vascular changes in the retina that result in the patient going blind. And so, in order to correct that, you have to see the ophthalmologist periodically to make sure that your blood levels are monitored because the hyperglycemia has a negative impact on the vascularity of the retina, and this then results in blindness.
Yeah, so I don't have glaucoma, but I look at my report, it says I'm a candidate for glaucoma.
But well, they measure your intraocular pressures.
Oh, yeah.
Yeah, okay, all right. Any other comments about the this suggests that you go to see your eye doctor at least once a year if you're not a diabetic. If you're a diabetic, more often than not, the monitoring is important to prevent the progression of diabetic retinopathy. The as Darrell had mentioned, uh, reason I'm not clear on, we do have much more glaucoma as a problem for people of color, particularly Black patients. And we do have treatments that require us to have monitoring and take medications and sometimes require surgery to decrease the intraocular pressures, which damage the retina and can lead to blindness. Any other comments or questions about this? So we can go to the next one. We have some other interesting articles. This is for people who are pregnant to stop GLP-1s and they start gaining weight. This is an issue that has been problematical for gynecologists, particularly, and so they want them not to stop while they're during the pregnancy because they have a tendency to increase their weight, and this then is a relatively new problem that the suggestion is that not to stop the GLP while you're pregnant. Well, I don't know that we've done enough studies on this here in the United States because the GLP-1 craze, which has been over the last 2 to 3 years, is is now something that is increasing more than ever. And then the association with the gestational diabetes and preeclampsia as well are issues that make monitoring pregnant patients very important. And so it's not recommended that you stop the GLP-1 during the pregnancy. Any comments about this? Because not many of us, about grandchildren and children are, we are. John Buchanan.
Has there ever been any studies about the effect of GLP-1s on children born from parents who are using it?
I don't know of any yet. I'm sure there will be, but I don't know of any yet. I think that's yet to come. Let's go to the next article. This is nitrous oxide is laughing gas, and many resistant depression resistant protocols exist, but the use of nitrous oxide for this has not been studied yet, and this is a request that this is a treatment for treatment-resistant depression that may well be more effective than some of the other antidepressant mechanisms medications that we're using. But there haven't been enough controlled studies on the use of nitrous oxide for depression. But this is something that they're recommending that we do more studies on to see if this will be a remedy for a treatment-resistant depression. As we know, laughing gas is the nitrous oxide that is used by the dentist to put patients to sleep, and this may be. Now we know that the psilocybin drug is something that's been used, and these hallucinogens are becoming more and more popular. But the nitrous oxide doesn't have as many side effects, perhaps, as the hallucinogens, and so they just thought that this is a reason why we should try laughing gas as a remedy, which may not have many of the other side effects of the other medications.
Dr. Callender, isn't nitrous oxide what they usually give you when you have a colonoscopy?
No, actually, most people use the drug that they sell on the street.
Oh, no wonder I never want to wake up.
I can't think of the name of it.
Fentanyl.
Fentanyl, yeah.
Really?
Yeah. Was
Oh
one
my
of the best
gosh.
ones because you eliminate it quickly. And
You do. You
yeah.
do. I always want to sleep a little longer than they let me.
But yeah, usually it's fentanyl that Darryl.
Yeah, laughing gas is used as a sedative in dental procedures.
Yes, yeah, for many dental procedures. Yeah, yeah. And it works, so it has fewer side effects. So it's something that we need more studies on. Yeah. Okay, let's go to the next one. We're getting close to the end. Some articles done. This is a kind of disturbing article that young adults seem to have so much loneliness in spite of having social connections, which is what we recommend for people who are lonely and isolated. And what they're identifying that young adults who are lonely and depressed because of so many things going on in our society. And of course, the remedy for most people is to really have great social connectedness. But in spite of this, we still have so much depression and suicide and so forth and so on. So the question is, what else can we do to help the people who have depression in spite of it? And medication alone is not the answer. Uh, uh, Psychological sessions are thought to be part of the answer. Uh, but Darryl?
Yeah, when I go out, when I take my wife out to dinner, I see a lot of young couples out, and they'll be sitting there on a date, or I don't know, but they're young. I don't know if they're on a date or they're married, uh, but they'll be sitting there. Both people are on the phones. Nobody's talking to each other. And I listen to a lot of young people when they talk about keeping in touch with family. They say, "Yeah, I keep in touch, but it's all text message. Nobody picks up the phone and has a conversation." So, if this is the world that you're living in, you got lots of social connections, but you never talk to anybody, and you wonder why you're lonely. Well, duh, it's because you never talk to anybody.
Yeah, that's a good observation. I've been disturbed by that. You see people walking down the street, and each of them have a cell phone. They're talking to somebody else, not to each other. And so we have social disconnectedness rather than social connectedness, because if we're not even talking to each other, and it's sad commentary. But that's an interesting observation, which many of us have noticed, even at the dinner table, unless you ban the cell phones. Carol?
I noticed also last Sunday when I had to go play for church, I went to church services. I left my cell phone at home. Then I try to remember back the days when we didn't have cell phones and you could leave the house without your cell phone. But now I commented to the grandchildren, I felt so naked without my cell phone. And they were because all of them are in school just and they have classes where they don't have their cell phone, but they said, oh, weren't you bored? And then I thought about it because sometimes during the church service, and I remember vividly, I went to church ritualistically without a cell phone, and I didn't have to look at the time, and I didn't have to look at a text message or worried about somebody trying to contact me or something like that. And I realized that I don't want to confess, but I'm almost addicted to a cell phone. So why should I feel so disconnected without that cell phone in my purse?
Well,
I wonder if anybody else has felt that way. You left the house without your cell. It's like your keys or something important that you need on your body. And we
It's
really
worse than
don't.
keys. You feel absolutely naked. It's your lifeline. Of course, it's people out on the street and stuff. And then I say, well, I wonder if I can use her phone. Well, why do you need to use a phone? It's because you don't have your own. Yeah, I agree with you. You feel naked without it.
Well,
Captive.
there's an article that is not included. This one because we don't have time, but it talks about the fact that the telephone focus is one of the biggest problems we have. And that, as you said, you get addicted to it and you think it's essential. When in point of fact, it's probably more essential that you get away from that addiction. But great observation, Carol. Any other comments about that?
Yes, I have done that, Carol, even though I definitely am not addicted to my phone, but because there are no phones like there used to be where on the corner, you feel like you need a phone, but the one time I remember going out without my cell phone, I thought about it for a minute, and then I remembered my watch is connected to my phone. So I called from my watch. So you always put your watch on. So my watch. It's a good backup.
Well, amazing, amazing. Okay, well, Sylvia.
I was just going to say, with those cell phones, you can't even remember telephone numbers. So what I had to do was go to Dollar Tree and buy me a book. So I'm going through my phone and write down every number because I couldn't remember. I had lost my phone and I couldn't remember John Tatum's cell number, but I could remember his home number because it was similar to mine. But trying to remember telephone numbers of individuals, like I've called Carol 11 times and I still don't know her cell number. So what I decided to do was buy a book and write down all the numbers that are in my cell phone. I haven't finished, but this is what I'm doing.
I got my old book from years ago. Yeah.
Next time you'll be getting one for your passwords as well.
Okay, thank you very much. Had a great session and look forward to seeing you again next week.
Okay.
Thank you.